Are you experiencing knee pain that is stopping you from participating in the sports that you love? Have you been told that you need to stop doing the sports that you enjoy? Otherwise, you'll be paying for the price of knee pain. Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you a case study of a lady who we met recently here in our clinic. This lady is in her 50s and she came to us complaining of knee pain. Now, she's had knee pain ongoing on and off for several months, and if really she thinks about it, probably over a period of a couple of years where the pain comes and goes. Nothing too severe that she couldn't put up with. However, at her last ski trip with her husband, she could barely limp off the ski slopes. The knee pain got to her. She saw her family doctor and got an MRI of her knee joint, and it showed that she had a strain on that ligament on the inside of her knee, swelling sitting on the front of her knee under her kneecap. They think that perhaps there's a slight tear in that cartilage on the inside of her knee, and basically otherwise nothing major has been torn, luckily. Her family doctor says to her, you need to stop skiing because that motion of side to side is putting a lot of strain on your knee joint, and if you keep doing it, you're gonna tear something. So she came to us thinking, is this it? No more ski trips? Her husband loves skiing, they're now retired. Could they not be skiing? Well, we carried out a full assessment on her knee joint, and the good news is physiotherapy can help her recover from her knee injury, and with the right training program, she can get back onto that ski slope. So the first thing we did was when we assessed her knee joint, we found a lot of swelling sitting in the knee joint. It was all pudgy and tender to feel around her knee joint, telling us that that swelling has been chronic, meaning the swelling and inflammation has been ongoing for longer than 6 months. We could feel the tenderness in her ligaments, and so we could feel that she probably had a strain in there in her ski trip that just aggravated it. So the first thing we do is we use low intensity pulsed ultrasound, which is this little machine. It helps reduce the swelling and inflammation in the knee joint and helps promote healing of the ligaments. We first do that to reduce the swelling so that she could then start to bend her knee better. We needed to work on all that muscle tightness that we felt on her knee joint as well. So the muscles above her knee, her quadricep muscles were tight, yet clearly weak because she didn't have stability in her knee as well. We had to work on the muscle tightness on the back of her knee, on her thigh, so her hamstrings, her calf muscles on the bottom, and we had to release the muscle tightness on the front of her shin as well. To do that, we used the radial shockwave therapy machine, which you see behind me, so that we could then now start to do a strengthening program. So the first 2 weeks we saw her 3 times a week using the low intensity pulse ultrasound as well as the radial shockwave therapy machine, and she immediately felt pain relief, which meant that she could move better and she could then actually be sitting on the floor to play with her granddaughter. Now that's fantastic, but we can't just stop there. We need to work on it, and we have been starting to do exercises to strengthen her knee muscles, and we will then progress to more advanced knee exercises whereby we get her ready for that skiing motion. So we need more dynamic stability exercises on her knee joint. So she's halfway through her treatment program. She's no longer in pain. She's able to bend her knees, run around after her granddaughter, which is exciting, but not quite ready for ski slopes yet. So we do need to build strength over time for her to be able to get onto the ski slopes and perform those really challenging side-to-side movements in her knee joint so that she will not injure her knee joint again. So she's excited and we're excited. So if you are out there and you've been told your knee joint is at risk of getting worse, you need to stop the activity that you love, don't despair. What you need to do is to ring us here at My Favorite Physio, speak to one of our expert physiotherapists, find out how we can help you overcome your knee pain. The number to ring here at My Favorite Physio is 0297904233. And if you know somebody out there who is struggling with knee pain and feeling quite down that they have to give up the sports that they love, why don't you like and share this video with them? Until next time, have a wonderful day. Bye.